It's my privilege now to introduce the second of our keynote addresses. So it's Linda from Queens in Belfast. Earlier on, when I first spoke at the very start, I said something about ECRs, and I said it's great having early career people in the room. Well, Linda is now going to tell us really why ECRs are important in understanding AMR. Thank you.
Thank you, Sam. Thank you so much, Sam, and thank you everyone, I should say Professor Shepherd, and everyone who has been part of this organizing committee. Thank you for inviting me. So I have really enjoyed the talks today. Anybody else done that? Really engaging talks, really did. So when I do presentations, I make you talk. So you might find I might ask you some questions. So I am Linda Oyama. Let me see if I remember what I was taught this morning. Okay, that's okay. I was like, that's not my slide. So I'm Linda Oyama, and I am the lead for Futures AMR Network, which is on the top there, and you'll hear a little bit about that later on in the talk. And because of my passion for ECRs, because I do think that ECRs are the game changers in this AMR space, and I'm just so delighted to see the number of young faces in this room. It's just life-giving, right? Clap for yourselves for being here, please. So, how many of you here are working in a discipline that is different to maybe what you originally started with, or, you know, outside of what you started with, or you wish that you could do? Show of hands. Yeah, a fair bit of the room. Well done. So, if you think about the fact that you're now using skills from a different discipline, or perhaps collaborate with people from other disciplines, then you can start to understand why cross-disciplinary approach is important for AMR. I will not go into the staggering facts that we've already heard today, but AMR, as we know it, is a One Health problem. Now, that's a word that we haven't used a lot in this meeting today, but in my group, we study AMR in the One Health context. And it's a problem for everyone, like we've been saying. Therefore, we cannot solve it through individual effort. We need to solve it through a collective effort. Okay, the solutions will begin, the innovations will begin with collaboration and with coalition of disciplines. We also had quite a lot of gloomy statistics today. The way I interpret that is that there is fire on the mountain. Anybody heard that song? And what do you do when there is fire on the mountain? Do you stand there idle? Yes? Do you take it slow and just have a walk around the park? Do you run? Come on, people, help me here. Yes, thank you. So we run when there is fire on the mountain. And that's exactly what we need to do in the case of antimicrobial resistance. We need to take bold, cross-disciplinary solutions. See all these talks we've had today, I'm thinking, wow, how can I use that for my research? Oh, that person's done something. I hope you were thinking that too. And I hope that you were not thinking, oh, that's cool, and stopping there. So, early career researchers, in my opinion, are the keys to disrupting and redesigning the future in AMR research. Okay? So, why are we game changers? I know you've heard this. You're probably thinking, what's she going on about? How are we even going to do it? I'm not a professor. I don't have a lot of money. I don't have a lot of ideas. I don't even know what I'm doing. I'm in the first year. But you have something that maybe the professors are getting tired of having. They just want to retire at this stage. Okay? You have fresh perspective. Okay? You have risk. You're a risk taker. I don't know how many of you go to your professors and go, actually, I did something in the lab. I wasn't supposed to do it, but this is what happened when I did it. And that's how new research happens. I mean, you may have broken that £10,000, £20,000 equipment, but you found breakthrough research that gave the group £3 million later on. And maybe you're the kind of person that's really adaptable. So you're fluid, you can move between disciplines, because for some of you, nothing is tying you to one place. You can go to a different lab, you can try a different technique, and so on. So you can code. How many professors can code? I mean, code. You can communicate, like we've heard from the last speaker. You can analyze. I mean, look at the wealth of data I've been looking at today. And most importantly, you can collaborate. I was very impressed that some of you were just walking up to people and just speaking. So you can. You have all the tools. So you are uniquely positioned to bridge all of that kind of gap. Okay, gone and done the wrong thing now, haven't I? Okay, so let's see. Oh yes, I'm still on track. So how are we going to do it then? Challenge the status quo. I mean, you're not limited to legacy thinking. Just because they did it in this lab like this for 20 years doesn't mean we have to always do it like that, right? You can question the method. Up till now, we talk about antibiotics and bacteria and things, but we don't really have enough information for anaerobes, for instance. The UCAS breakpoint has, what, 9 anaerobes of human origin? So why are you not developing new methods? Why? Why are you not changing how you're doing things? You have new methods like AI. Leverage the data that you now have, which our professors and very wise professors didn't have in their time. Enhance these solutions and be able to predict resistance and so on. What about thinking outside of the lab? We've heard today about policy, we've heard about law, we've heard about economics, behavioral science. How are you using those in your research? And we've heard most importantly about communication. Now, that was a very good story because you know what? I've heard so many things about people even saying that it is the antibiotic that is resistant to the bug. So there's various different versions. So how do we communicate that? Are you joining the AMR discourse or are you just a bystander? Okay. So what are some practical steps that you can take to being a game changer? Who is a game changer in this room? Let me see your hand up. I'm not a passenger. I'm not a spectator. Come on, put your hands up. I can see some of you there smiling at me. Thank you. So, because we have so many game changers in the room, what steps can you take? Build cross-disciplinary networks. Now, IOI on its own is a network, a cross-disciplinary one. So that's why you're here. Right? But there are so many other networks that you can be part of as well to learn what they're doing. But don't just join them for the sake of joining them. Actually actively participate and change what's happening. Okay? Now, you can do public engagement. I've been going on about how we need a whole national AMR campaign. And by the way, the last speaker, I think the next time we have AMR week, each of your videos should feature at least once a day on national TV. Thank you. So, I've been working with somebody who does storytelling as well from the University of Teesside. So this is really important. I was very glad to see that talk on the list today. What else can you do? We think that only professors can find funding. What about ECRs and their ideas? When are you ever going to get funding for it? I think you need to start, even if you can't apply by yourself, bring that idea to your bosses, to your supervisors. I am sure that in this generation, they will let you take ownership of it at some point. So don't forget. Don't forget to bring it to them. I had very good experience with my bosses. They let me take ownership, okay? And I'm sure that the ethos is the same in here. But apart from applying for funding, when can ECRs start to put their voices onto the agenda of what should be funded? Are we going to continue funding the same type of science from before? Or can we start to change the things and inform our own voice and say, actually, we want you to fund this? And it's not just the research, but we also want you to fund our lives, to support us. How many people can't do their AMR research because they have to give it up to go and start a family? They have ideas, and that idea has died with the 4th child. So, develop an entrepreneurial mindset. I know it's not easy, but if you have a little bit of a business bone in you, I think you should try to pursue it. You need to prioritize. I like how we're very diverse in the room today, but it mustn't stop with numbers. It must continue with conversations. And like I say, you need to look after yourself. You have to be well-rounded. Now I'm preaching to myself here as well. Okay. Didn't get enough sleep yet this week. But then we need to start to think about how can we personalize the things that would help us make solutions in AMR. So what do you need as a person? What kind of training, what kind of support do you need? What kind of mentorship do you need? And in order for you to make all these changes, somebody might think you're crazy. You're a disruptor of peace. But actually, Steve Jobs says something. The people who are crazy enough to think that they can change the world are the ones that actually do it. So don't let somebody make you think you're crazy. Actually start doing something with your crazy. And that's why I'm going to quickly introduce to you Futures AMR Network. Do you want to become a part of something that is completely ECR focused to allow you to be the next generation of AMR leaders? There are plenty of networks in the UK, but recently the UKRI funded 8 more of those networks to tackle antimicrobial resistance from a transdisciplinary approach. You can see all of them on the bottom there. And I put others because tell you what, there are so many of them and they're doing amazing things, okay? And we are just one of the 8 new ones. We're like the babies. But we are an ECR-led network for ECRs to tackle antimicrobial resistance. Why do I keep doing that? Okay. So, what are we about? We want to harness young talent and provide innovative solutions to the AMR challenge. We want to connect you with each other. We want to make sure that different voices are heard and it's inclusive and it's representative of the AMR landscape and the UK population. But our ultimate vision is to make sure that we can attract multi-sectoral expertise and introduce you to transdisciplinarity, but to deliver support and mentorship, as well as help you know how to engage with the public, so that this AMR problem, hopefully, will be less of a problem in the future. We look like this currently, the people who lead the network across lots of different organizations. Our network manager is sitting right there behind, Dr. Prachi Bendali. I'm sure she's been trying to scope some of you since she's been here. But we also have partners so in government and industry who have come alongside us and are really keen to help young people and ECRs. So please come and join the fun. And what we offer, 5 main things. We will have some events that would help you connect with other people. And at those events, you can bring your babies. There's going to be crash. Okay, that was covered in the costing. Okay, we put it there. So don't worry, just bring them all. We will make them do AMR activities. Mentorship training will be there. So we are partnering up with another network, the People AMR Network, to build a networking scheme for ECRs. There will be training sessions. We're partnering up with Target AMR, which Ted talked about earlier, and Fungal One Health AMR to give specific tailored training in specific areas. And then we have our AMR solutions, which are small pots of money to help you kind of bring those ideas to life. So we'll be advertising this soon. The criteria being, you need to form a transdisciplinary team to do it, okay? And then we have something very important, which I think is very important, an ECR AMR blueprint group. And what that group is tasked with doing is to gather ECR perspectives on the AMR problem. And it's not just about research, but about their lives as well, so that we can present this as a recommendation document to the UKRI and the UK government, hopefully, about what ECRs think should be happening in the AMR space. And I think that would interest some of you. Okay, so you can become a fan. Okay, and you can sign up to a work strand. Okay, because we don't just want you to become. Yes, I know that sometimes capacity means that you cannot do much. So you can become a fan or you can sign up. You can find us online as well. We're everywhere. So my final challenge to you as game changers is that the future is in your hands. And you are not just the next generation of researchers. You are today's innovators. And because of that, you need to take at least one step today. Don't be like that person. We're not doing the law of inertia here, okay? I don't know if many people remember that. Don't be reluctant to move, okay? Take one step today towards cross-disciplinary collaboration. Don't be waiting and saying, I'm going to wait. I'm not yet a game changer. You are already one. But you just need to do something to make the world see it. And as a game changer, if you haven't spoken to anybody at all today, maybe you only spoke to people from your group, please do that before you go home. Try framing your next research question around a real-world impact and say yes to something that scares you. Because the best way to be a game changer and to make changes for the future and predict the future is to create it. Thank you very much for listening.